Hello, Doña County. This is Anita Skipper with the Public Information Office. I am the Chief Public Information Officer for Doña County, and we have a special occasion today. We are so delighted to be on location at the Crisis Triage Center celebrating their 1-year anniversary. Now, if you all stick with us, you'll see that all week we're celebrating because this really is a big deal. And so we want to take some time for you to get to know the Crisis Triage Center and the special people who make this a wonderful place. So I'm going to introduce you. Well, you know what? I'm going to allow my guests to introduce themselves to you today, and then we're going to talk. So please, while we're doing the introductions, share this live. But most importantly, grab some paper if you need to take some notes. This is an opportunity for us to let you all know why the Crisis Triage Center is here, why we should all be supporting it, why we should be honored that we have a facility like this in Doña County. And then we're going to take your questions at the end. So if you've been wondering some things, or maybe you've never even heard of the CTC, as you'll hear us refer to the center, then this is your time to get some answers directly from the people who work here and care for the many people who walk through the door. So how about we get started, guys? All right, so directly to my right, go ahead, introduce yourself.
Hi, my name's Karina Diaz, and I'm the Site Director here at the Crisis Triage Center and work for RI International.
Okay, fantastic.
Hi, I'm Jess Spohn. I'm the Clinical Director over here at the CTC, and my pronouns are they, them.
Right.
My name is Malachi King, and I'm one of the peer support specialists here at the center.
Okay, thank you so much. So we have Karina, we have Jess, and we have Malachi. So thank you all for being here. Oh, there's just so much to talk about. So where do we start? Because we don't have all day, although I'm sure you all hear everything. So let's go back a little bit for people who have not been just aware of the CTC and why we're here. So if you had to meet someone in an elevator out here, what would you say to them if they saw your badge and it said Crisis Triage Center, and just imagine, go, what's that? What would you say?
Well, the Crisis Triage Center has been opened exactly a year today. So that's first and foremost. Very exciting. It was something that's been in the works, I think, for Doña County for years. And they partnered and contracted with RI International. That's our organization, a nonprofit international organization that focuses on peer support type of being the first line of providers who are working with people who have either or struggling with mental health illness or substance use in different lines of work. When we started the center, we started this crisis receiving center 24 hours a day to be able to provide services for anyone in the community, starting at the age of 18 and older. Anyone who's having a bad day, doesn't really know what's wrong, or maybe they do know what's wrong and they want to speak to someone and kind of understand a little bit more about what's going on for them, and speak to providers or people who actually have the direct experience in behavioral health and substance misuse, rather than an emergency room facility, which is more medical type of service. So that's how I would describe what we do, and generally speaking. And also what's at the heart, I think, of what we do is having people who have lived experience, like Malachi, that can provide that direct care, that can provide a sense of hope, and that recovery is possible for any one person.
Okay. Now, we were at the 20th floor, which is why Karina was able to share all of that. But we're going to come back because she shared so much in her elevator pitch. So we're going to move on and because those are all, I can't wait to dive into that and hear your story, Malachi, and just break that down. Jess, what's your elevator speech for CTC? What's that?
I would say that the Crisis Center is a safe place for individuals that need help with mental health or substance use, that really just need a little bit of extra support. There's no wrong reason to come to the Crisis Center if you're not feeling your best or you need, a little bit of extra help.
Okay, very good. We're gonna dive
That's
into
my one
that as
floor.
well. Yeah, you just came down. That's good. So Malachi, what would you say? I see the badge. Where do you work?
So the center is right, obviously a safe place, but with peers that are going to empower you, through your recovery and help you the best we can, and always do what's best for you. That's what I would tell anybody that I see in the first floor.
Okay, so much to unpack there. So one of the things I always hear, there's such a stigma around mental health support and all of that. And I know that we are doing a much better job just as a world, a people, to talk more about it and normalize. It's okay. It's okay to have a bad day. It's okay to say you need some help, some support. So for the person who's watching who says, well, how do I know if I'm just having a bad day or if this is a mental health crisis or something that I need support on? I mean, where's that line of do I just have a bad day? Mm-hmm. How do I know the difference?
It's hard to know the difference for a lot of us, for human beings. So I would say you don't have to know the difference. I would venture to say that here is a place where we can provide the evaluations, the assessment to help sift through what may be going on for you, and what types of supports, because it could just be psychoeducation for you and the ones that live with you. It could be as simple as maybe scheduling or helping you schedule a therapist appointment, but you don't need to go through that assessment on your own, right? Even if there's doubt or something's amiss, and I just maybe need to talk to someone so they can help me figure it out, that's what we can do here.
Okay. So I'm going to still go further with that. I'm having a bad day and I'm comfortable talking to somebody, obviously, because you have to be willing to let someone in and help you figure it out. I come to the CTC. What are your hours?
24 hours a day, 7 days a week.
Okay. So when I come, how am I treated? Because I'm already maybe on edge or feeling a certain kind of way. And then I walk through the door, I'm unsure. So hopefully after this video, not today, but we will show just what a day looks like if you do come here, because we want people to understand the whole process as much as we can possibly show. But Jess, I'm curious, what would you say is like the normal reaction of people when they walk through the door?
I think when people walk through the door, depending on what their experience has been before, right? Some people might be a little bit ambivalent. They might be a little bit scared, right? Which is understandable because it's something new, right? You're trying out something new, especially if you haven't been here before. But we've got our great peer support specialists that meet you as soon as you walk in, and are willing to be there and say, hey, what is it that we can help you with today? And that really puts people at ease. You can literally see on like the person that they walk in and maybe they're a little bit hesitant, and then they get greeted and they just kind of start to relax already right away. Because that's the kind of atmosphere that we have here, right? We're laid back, we're respectful, we're here for you, right? And I think it really makes a difference the way that we treat people.
Yes.
To piggyback on that, why is there a CTC versus you always hear where there's counseling available? People can seek out counseling if they need help. So why did you think there needed to be an injection of a center like this versus just go get counseling if you need help?
It's a great question. If I may start. Sorry. Because a lot of times it's exactly what you described, and Jess was also talking about. Someone might be hesitant to ask for help, and we might not really know, is this something that I need to speak to someone about? Like, I'm feeling a little off, like I don't know how I'm feeling, like should I talk to someone? What are they going to think about me? Sometimes we let it get to a place where we might feel really badly, and then we have to go to the emergency room. So that's been kind of where we as a society have been in terms of trying to receive any time crisis care. So this is more of a centralized location where there's behavioral health providers, psychiatrists, RNs, clinicians, licensed behavioral health providers, peer support workers certified, who all understand the gamut of the behavioral health field. And in this center, then we're able to provide the different assessments, psychiatric evaluation, psychosocial evaluation, and a treatment plan to help you get to and try to decide what it is that you need. Because you might not need counseling. You might need other services.
What's psychosocial evaluation? What does that mean
Yes.
to me?
What does that mean to her, Jess? I will let you
You want
answer
me to do
that
that
as a
one?
clinical
Okay.
director.
I'll do psychosocial evaluation, and then I'm going to build off of what you said on
Okay,
the CTC,
great.
right?
Sounds good.
So a psychosocial evaluation is basically like a list of questions that the clinician will ask you to see what needs that we can meet or we can help you meet, right? So what is it that's causing your crisis? What's causing your bad day? What's the root of the problem? Where's it all coming from? And what can we do to help connect you to feel more confident in your ability to manage your stress on your own? Right? And so that's where that's what the big word of the psychosocial, right, evaluation is. And I think that here at the CTC, we're a great kind of middle ground, or even a hub in a sense, in between that outpatient and the inpatient, right? Mm-hmm. And so your therapist, if you already are connected, right, with an outpatient provider, with a therapist, they're not available 24/7, right? They've got their own life to do. They've got other clients that they've got to see, right? They've got a weekend, right, to be able to, to decompress for themselves. And your spouse and your mom and your best friend can only do so much, right? On that times when, a therapist or someone else, that's your support system isn't available. Mm-hmm. And so here at the CTC, we're a great place to be able to come, and we're open 24/7, 365, and we've got staff that are here that their whole purpose of being here is to talk you through whatever stressor, whatever is going on in your life that's making you feel like you are uneasy or you can't handle it, or you feel like you need to use drugs or alcohol to cope with whatever's going on, right? We're here all the time, right? And so we can be that great in between. Or if you don't already have a therapist or a provider and you're not sure if you want one, or you are sure, but there's just so many options out there and where do I even start? We can be kind of that funnel, right? We can be that hub that can connect you to all the different places that you may want to go, whether you're aware of them already, or if we can give you some suggestions to say, hey, have you thought about this? Or like we've got this place that we use, what do you think? Or, here's a couple different ideas on places and people that can help you maintain that confidence and that feel better vibe once you go home.
Okay. That's great. I like that, especially if you don't know where to start.
Yeah.
A great place to start. Okay. So, Malachi, why is it important for someone to be here in your position? Just take us back to when maybe you were in this position. What did you need from a Malachi when you walked through the door?
So, we can take it back. One thing why the center is so important is when I first was going through my recovery and starting is, I wanted to go see a counselor first. But then I was like, call this place. And it was booked a couple months. Let me call this place. It's booked. But I didn't think I needed maybe inpatient. So to me, why I love the center so much is this is the hub for them where they're willing, they can come here right away and get that. They can get everything they need right here and then and be able to go back out into the community if they need to. And for me, a big thing why to have one of us there is I can give them that experience. I was in your shoes that day one. I feel how it feels, the shame that you might have, the anxiety, the depression. I feel that. I know how it feels. I know how scary it is to talk to a clinician that you don't know nothing about, and tell your story over and over again.
That's powerful.
Very well said.
Yeah, very much. So, wow. Yeah, Malachi. I was so in, right? I was like, yes, I can see that, because sometimes you do feel like it's just you. Right. Nobody will understand. Mm-hmm. And it's good for someone to see it from the other side, because when you're trying to help people, a lot of times there is a lot of repetition and they're having to rehearse whatever it is that they're feeling. So I can definitely see the value in that.
And two, just being that warm face for them, that they're like, okay, you've been through this. You know the struggles I've been through. I know what you're going through right now. I know how this feels. You know, so that's that connection we get with them, and then, you know, helping them and empowering them to be like, you got this. You got this. You can do it.
Yeah. So as I'm hearing you all talk, I'm thinking about just the national conversation that's being had around mental health and substance use support, all of that. And the conversation between what do we do? Do we do anything? Is there help? And so it just makes me wonder, why did RI choose, okay, we're going to be a part of this solution, right? Because there are a lot of communities who just, it might be easier just to not deal with it or kind of keep kicking the can down the road. You guys have taken on a pretty big undertaking, and I'm hearing that people can come as often as they need to. So many people, I know just from gathering data and working with organizations, that want to know about outcomes. What were your outcomes? How do you judge how effective you're being if a person comes today and then they go back in the community and then they need to come back next week and they go back in the community? What are your successes? Like, how do you judge success from being here?
I mean, it's interesting. It's like, yeah, it is. And it's a question that we have in mental health field for decades, right? In general. But one of the things that is so important about a center like this, one of the things that we do each time a guest comes in before they leave, is that they answer a survey, a satisfaction survey, which is one of our main kind of ways to see, based on those questions, like, did you feel that your integrity was respected when you walked into the center? Did it help to speak to a certified peer support worker?
Did you get connected to community resources?
Exactly. Right. So those are really important questions that we look at to help figure and tailor our response to ongoing crisis in the community. We also have we're a procedure in which we call anyone who's been here before after 72 hours to see how they're doing, if they connected to the services we referred them to, and we track that as well. When I said it's a decades-long question in the mental health community, is because a lot of times when we gauge success very in a linear kind of way in other fields. If you do this and then you do this, this is the outcome. But in mental health and substance use, it gets a little bit, it's not as linear. We're human beings, and recovery can be a lifetime, right? If someone is recovering from alcoholism, there's not going to be a set point, okay, I'm cured, right? It's a way to maintain, right, your ability to function in your life in whatever aspects of your life you want to function in, right? Having a job, keeping a job, having a relationship, having a fruitful relationship, being able to have your friends, and right, being able to hold a house and keep the payments going for a house or an apartment. Those are all ways in which a person feels valuable in a society. And substance misuse or an alcoholism or PTSD, that has been decades long building, it may take years. And there may be situations in lifelong that could trigger some of that. And you might need some extra support. And that's okay. So that's why it's hard to answer for me. You know, you might have other kind of or add, but that's why it's not as clear cut, I think.
Yeah. And listening to you, it makes me think of some of the things I've heard and read in the news where they talk about, well, they've only seen this many people. I think a big part of that comes through understanding the point of your existence. And what I envisioned when you were talking was like the hospital. We don't ever say you got hurt once, you'll never need to go to the doctor.
Right.
it's as needed. So you're not the end solution. You're here along the journey, which is great. So if someone's watching this and they're not sure, should I go there? Why? What's their purpose? Like, your doors are open whenever. So
come check it out.
Yeah, I just saw that differently because I've been hearing people say, well, they've only done this and that, and so we really want to focus on the purpose and educating the community on why we're here, because I think some of the confusion, the frustration, all of that comes when people don't understand your purpose. Sure. And so thank you all for being this resource, an ongoing resource for any of us. So let's talk about who's welcome. You mentioned earlier 18 and up. So if there is someone who's not 18 and they show up at the door, what's the process for them?
Very great question, and we will connect them as much as we can. We will not be able to enroll them in our services, but we will definitely find resources for folks.
Okay, so their parents would be responsible for that because they're underage, obviously. And then you talked about 24/7, so great. That means anytime, 24/7.
Literally anytime, right? Like you were mentioning with the ER, with the emergency room, like, oh no, you broke your leg last week. Sorry, you met your quota for the year, right? And so, we're similar in the sense that you can come anytime you need it at any time of day for whatever reason it happens to be, right? And so we don't, when you get injured, right, and it's like 9 o'clock at night, you don't go, ooh, like, do I need to, I'm bleeding a lot. Do I really need to go to the hospital, right? You're just like, boom, I need to go to the ER, right? And so that's what we want the community to consider us here, right? Is to not hesitate. Like, I'm not having a good day. I'm having a tough time. I'm struggling. I need to go to the CTC. Like, it should be like that automatic thought without hesitation, because we're always going to say yes, and we're always here. We take insurance, but insurance isn't required. You're never going to have to pay out of pocket to come and receive services, no matter if it's your first time or your 25th time, right? So you're not going to get stuck with a copay or, some type of out-of-pocket cost, big bill to foot for coming to get help. And so, we're here to be accessible and to be the place that says yes when a lot of other places gotta pause.
Oh, Jess. So you just triggered something. No bill. So how are you all able to just be in business? We're in a capitalistic society that says, where's the money? So what makes this possible? That you can be here 24 hours a day, 7 days a week, 365 days. If insurance, then you take it. Otherwise, no yes, no no's, basically. Say yes to everyone. How are you able to make that happen?
Well, we are able to take insurance.
Okay, right, if you have it.
If you have it.
Right.
And also the county is helping as well to pay for services for the community.
Okay. So someone's paying, but it's important that you get the help first over the money, right? So
yes, let not that be a deterrent.
There you go. Okay. So let's talk about the W's of the CTC. We've covered some of them. So we said the who is 18 and up. Anyone who walks through the door.
Yes.
The what, you talked about doing an evaluation to help figure out what they want. The why, it could be anything. We're all human. We're all different. We have different life experiences, right? The when, 24/7, 365. Can't be more simple than that. And then the where. Where's the address? Where are we?
It's 1850 B as in boy, Copper Loop.
Yes.
Copper Loop. Is that 2 words or one?
Two words.
2 words. Copper Loop. We're here in Las Cruces.
Yes.
What if I'm not in Las Cruces? I'm in Doña County, but I'm not in Las Cruces, and transportation is an issue. Is there an option?
Yes,
sure
right,
is.
Jess?
There sure is.
Right, Malachi?
We'll pick you up.
You're gonna pick us up?
Malachi will come and get you.
We'll pick you up.
We will definitely come and get
So you do have a service where you'll come?
Yes, we have transportation. If you can't come to us or you don't feel safe driving, we can, in the Doña County area, we'll go pick you up.
So that's all the way down to Sunland Park, over to White Sands, up to Hatch, into Mesilla, of course, Las Cruces and Doña County, and all those surrounding areas, right? So anywhere, as long as you're within Doña County lines, we can come to you.
Right. And we will do a quick assessment over the phone just to ensure that you're safe waiting for us. Because if you're, 90 minutes away, we want to make sure that we are a behavioral health response and that not a medical transport is needed or things like that. So we will help figure that out as soon as you call us.
Okay. Any time of day?
Anytime.
Anytime.
Oh, wow. That's cool.
Saturday morning at 2.
So, wow, that's great. I do these. I love these only because I learn so much for myself. Hopefully you all, even if you find that this is something that may not fit you in the moment, I'm sure that there's someone in your life that you love that needs this information. So please don't keep it to yourself. Please share it. But also, we are human. Life happens to all of us. It may not be you today. But you might be thinking or going through something tomorrow or next week and go, CTC, I just watched that podcast on Facebook Live the other day. So I just keep thinking about, we hear the conversation around people who are in crisis and we often don't know what's going on with them just by looking at them, because you never know what people have gone through. And I just remember times where I've seen people, the first thing is, we take them to jail because that's kind of our crisis management system in many cases. Okay, in the short term, let's go do that. So let's talk about your relationship with law enforcement. What's the relationship intended to be? And then we'll talk about what it actually is, because we know that we're morphing to what this relationship is still growing. Just Definitely. Your presence in Doña County. But RI has done this across the nation. Mm-hmm. I mean, they're the leader in crisis care across the nation. So how do you work with law enforcement, or let's just say public safety officials to begin with? Because you may find people at different places in the community.
Well, right now we have ongoing conversations with Las Cruces Police Department. That's a once a month meeting, right, Jess?
Yep.
And we kind of sift through some of case examples that could be maybe have some challenges or questions around. But Las Cruces Police Department and all the different law enforcements are able to just bring folks here through our first responders entrance, and we can, as soon as they come in, it's a quick under 3 minutes, just a brief synopsis of what may be going on, and then we'll take it from there. So ongoing meetings is an important part of that. We also just finished having a week-long training for Las Cruces Fire Department, first responders, to let them know about our services, presenting on our services and how we can work together. So we'll continue to build, like you said, those relationships. As it stands now, any law enforcement agent could come in, officer could come in and just drop someone off. We also have a collaboration with a detention facility next door. So as soon as anyone is released from the detention facility, they could, we meet them at the door. I meet them. Yes. Yep. Malachi.
I go sometimes too.
Just Malachi. 24/7. We'll meet them at the door, just to let them know what we do and what. And
then we're here for them at any time they need. So they don't have to come right away if they don't want to, but we're here. Just planting the seeds that we're there for them. Making sure they're safe.
Did I miss anything?
I don't think so. Las Cruces Police Department is one of our main referral sources, right? So we work very closely with law enforcement in town and first responders, because we can be, we are another option, right? And so the officers recognize that this person that is experiencing, maybe an alternate sense of reality, or they're suicidal, or there's some type of substance use that has caused them to shoplift, or, something is going on out of the ordinary, they can bring them here. instead of having to take them to jail, right? Because they're going to get the help that they need while they're here. And so, we have, just a great relationship that, as Karina was mentioning, we are continuing to build, right? Because it's just all about getting the word out. And, as the officers come, right, and they see how quick it is, right, in and out. I mean, can you imagine if, instead of going to the hospital and having to wait, for some
hours,
for a long time, right? You can come to the door, ring the doorbell, and say, hey, I've got Jess here, right? And Malachi will say, welcome, Jess, thank you, officer, and get the badge number and send them on their way with a cup of coffee, right? We want to be that easy even for law enforcement, not just for the guests that are coming on their own.
Yeah. And I don't want to, I'm a communications professional, so I believe in tackling things head on and not running from certain stories. In the beginning, I know there were some headlines about us not being fully staffed and a person being turned away that made the headlines. And I know you all addressed that, but I just want to make sure, in case there's someone who's watching this who's still hanging on to that.
Sure.
One of the things I always like to say to people is, in the beginning of anything, there is a building of trust. There is a confidence build up. You're forming your identity. You're figuring things out. Until you're in a community, you really don't know how it's going to go. And I can say Doña County is tackling something that many communities are not ready to do. And it's not about perfection. I think of you all as progress over perfection. We're getting better. We're getting more people are finding out. But this is developing a brand. This is developing some recognition. I think about many of the services and the different organizations that we all take advantage of today. We know and we love, and we couldn't imagine our lives without them. But I would just challenge you to think about when they first started. Many of them, people protested against them, didn't want them, didn't think it was needed, wanted to know how it would be funded. It's useless. Why are we doing that? And the more they just embedded themselves into our lives in the communities, we realized the value there. And I see that becoming more and more with the CTC. The more people that find out, the more people like Malachi who tell their story, who say, I don't know where I would be without that. So unfortunately, doesn't mean that there are no hiccups. No. but we learned from that, right? And I've seen ways. So can you talk about some of the things that you all learned just from that one experience?
Wow, so many things. So many things. I mean, I love that we're here at 1 year talking about this.
Yes.
Because it is a huge undertaking to start a 24/7 center such as this one. For the last 20 years, I've been in my whole mental health in the field experience has been in New York City. And coming to Doña County, I'm always impressed with how progressive it's being in handling its crisis care in the community in the way that they're doing it here. But it is a huge undertaking. And one of the things that we've seen after COVID, during COVID, we're still in COVID, has been the lack of credentialed folks that are kind of taking these on-site jobs. One of the things that we saw during COVID, I saw it over there in New York City, but we see it here too. A lot of people, a lot of nurses, a lot of licensed clinicians stopped doing the work or have kind of pivoted to a different line of work altogether. It burned a lot of people out. COVID did a number on all of us in the healthcare industry. So one of the things that we saw that very brightly in that incident where we had RNs on fully staffed, 1 RN per shift. We also had an agency and we had pool nurses. None of those were available at the time, right? So we also saw how important it is to have these layers of nursing to create these backups, to create these kind of relationships with other agencies just in case something like this were ever to happen again. We have had the wonderful, Jess is here, our clinical director has been in the community. Our nurse manager has been in the community for years as well. Having people who are embedded in the community and know, have built relationships over time with a lot of these professionals has served tremendously for us to be able to be fully staffed and have these layers of professionals that could aid in case we are not, we're needing someone, right? People get sick, people have emergencies, healthcare providers have emergencies too.
Yeah.
So we want to
people
You
too.
guys are never supposed to have
On
we
call
want you here all the time.
Malachi's here all
Oh yeah, Malachi's here 24/7, with the exception of Malachi and other people. Yeah.
Yeah, and I think it's important to mention, right, that as we grow, right, we're growing with this, and so we haven't had that issue again, right? We haven't had to turn, we haven't turned anyone away, due to staffing issues or anything like that. We've been able to really ramp up and make sure, that we have everybody here that needs to be here so that we can serve the community.
Right.
So if you show up, and you're over 18 and you say, I don't know what I need, but I need to be here, we're here for you, no matter what time it is, always.
Very good. All right, so let's pause here because I want to see if we have any questions, and then that might lead into some other things. I don't see any questions. Do you all see questions? Okay, so if you're watching this video on replay, please understand that we do monitor our videos and go through any comments. And so if you have some questions later, go ahead and post them and we'll still get an answer for you. You have that question, someone else may be watching it later and have the same question. So we want to be able to provide an answer for you. All right, so tell me this, Malachi, what do you think is something that people don't always think to ask? Is there something that someone should know about the CTC, this environment, that they just don't think to ask that you normally need to remind them of?
Right. One thing is being able to come back and being us with open arms, being come back if you need to. Being when a guest discharges, saying if you need us, come back to us no matter what. We're never gonna shut the door on you or treat you differently. We're gonna be 100% the same every time. And I love that. That's why I tell them, so they're like, I feel safe here. I feel like I can come back and I don't feel ashamed for coming back. And that's just the blessing we have here, is being able to do that. Them being like, instead of using today, I came back to the center. And that's a great thing. Or hey, I felt suicidal today, but instead of staying at home, I came to the center. That's so much positive for them, is having this place here. So I always tell them, come back if you need to. That's the big one. Come back if you need to. Don't feel ashamed to come back. Don't be afraid to ask for help again. That's one thing.
That's good.
It's big.
It takes a special type of person to work in any kind of, I think, just healthcare, any kind of care where you're serving people. And I'm sure you don't get as many thanks as you deserve. Mm-hmm. I'm just curious to know your backstories. Now, I understand, Malachi, that you are a peer support specialist. Been there, had your own journey, needed a facility like this. In fact, did you come to this exact facility?
I actually didn't. I'm from Cruces, so we didn't have that facility.
Didn't even have it at the time. Okay.
We had the building, but just no.
Yeah.
No.
Not yet.
And that's the thing. It took a while. This has been a labor of love for you. So it took a while for this building to actually open up. But you could have gone into anything. You are a bright young man with a bright future ahead of you. Why did you choose to come here and do this?
Why I came here is because it's so important for us, and the environment we have here is amazing. the care that we give here. And then just going through our ethics as RI International, they align with mine, what I believe in. So that's why when I saw the job opening, I was like, it aligns with what I want to do, and I got the job.
Give me an example of some things that lined up with what you.
The main thing was always saying yes, empowering the guest, being able to have a peer on staff that's lived through it. That's just one thing you can't, learn in school. You can't, is our past, our shared experience of what we've been through. So that was the biggest thing for me, is being able to have that, and having all different types of peers here with mental health, substance abuse, both, it's just amazing to have them.
Yeah. Wow. Okay, and Jess, how did you get here? Like, how long have you been providing this type of care, and what moved you into this field?
I've been in Las Cruces for 10 and a half years. I'm originally from California, and I have been doing like behavioral health, mental health, substance use work like the whole time that I've been here. I came from California for grad school in public health, and then I went to school for social work. And it's really what I love, kind of like Malachi's talking about, like, the values of RI. I feel like also not just the values of RI, but like social work core values. Like, I looked at the profession and I said, this is me in a profession, right? This is everything that I am and everything that I want to do. And so I've worked in outpatient settings with the ACT teams, in inpatient settings, at rehabs, at the university, LGBTQ plus individuals, right? I worked with a lot of different populations in Las Cruces and El Paso and the surrounding areas. And what I really love to do is see people understand and just have it click that they can get better no matter what's been going on, right? No matter how many times you've tried to get sober, there's still one more time, right? There's still a whole nother time that you can do something differently, right? No matter how deep and dark and scary and awful your depression is, there's always a way out, right? That can bring you into healing. And I love just being in an environment that pushes people to see their strengths and see the good things about them, and that they can do it in a society that's just got so many no's. Right? Like you missed too many appointments, you can't come back here, or you've been to the hospital how many times and you're not better now, or I've taken this many meds, and there's just so many no's that I'm proud to work in a place that we always say yes, right? And we're always going to try to find another opportunity. If this is your 17th time that you're here, we're going to say, all right, so far what's worked and what hasn't worked and what else can we do? Right? We haven't tried going to the shelter and petting cats. I don't know, right? Like,
right,
what else? How can we help, right? There's always options, and that's why I love doing this work, is helping people realize, their potential and what's out there for them.
And Karina, 20 plus years now.
Yes.
How did you find yourself in this field, this arena? I know we tend to start with one thing and then you start to, I like it over there and I like it over there, and so we kind of morph into this new spot. But how did you find yourself here? Why is this particular audience or target, why is this important to you today?
So many reasons, and they all accumulated through the years working in mental health. I am originally from Mexico. I'm from the border, Juarez and El Paso. And I went to UTEP, University of Texas in El Paso, for undergrad. Went to NYU and decided to have many years of experience there. I worked with children and families. I've worked with adults, children and adolescents. Have worked in all the populations throughout a developmental span. Have worked in mobile crisis in New York City, have worked in outpatient mental health care, in inpatient. And in the last position I was in Brooklyn, I was a director of a mental health clinic. And one of the things that I always dreaded was calling 911 when someone was having a bad day. When they were saying, maybe that they had thoughts of suicide and we knew there was an intent to harm and we needed to call 911 or we needed to send them to the emergency room. And all of the obstacles, just, I would feel like letting them go was like, what's going to happen at the emergency room? It's full of well-meaning people, but the focus isn't necessarily behavioral health. Right, so a lot of times they would wait there for hours on end without anyone talking to them. And then by the time they saw a doctor, they would do a quick kind of like 15-minute, are you okay? And they would say yes, because I've been here for 3 hours and I want to leave. And they would be out the door. And then it would be kind of a revolving door in that case, because then we would have them back and then with similar things. So it wasn't being addressed. The crisis care for behavioral health was not necessarily addressed. And it was always, each time they came, or we called 911, it was like a SWAT team before the EMS would show up. Right, so exacerbating all the symptoms that we were trying to take care of in the first place. So, COVID happened. Family situations brought me back to this region, which I'm thankful for. And found that RI International existed and was doing this kind of work, which I always felt there's just a need in the whole of the United States for, and thought that it was incredibly progressive and where I wanted to be. And like Malachi and Jess have said, just creating an environment where there's acceptance, no matter who you are, no matter where you come from, in that we have staff who, no matter who you are and no matter where you come from, we're a place for you not only to work with, to work in, but also to help.
Very good. Let me see if we have any questions before we go. Looks like there aren't any questions that I can see here. I just want to make sure. If I do happen to miss your question, we'll respond later, but I don't see any popping up on the thread. So I understand. I will give you all your day back, but thank you so much for what you do. And excited 1-year anniversary. Yay! And we are up from here. I mean, there are a lot of people who can't say they've been here a year later in business, and you all are making a difference. I know if there's one person who walks through this door and has a different experience, you've just made the all the difference in the world to that one person. And Doña County, they're here. They're here to serve without shame, without blame, just open arms. And so if you have not visited the CTC and you need to, or you think you may need to, it's okay. Come in, hang out, figure it out. You don't have to have all the answers to show up. So thank you guys. I know, and please give our thank you and happy anniversary to all of the wonderful people here who make this operation successful. We are proud to partner with RI as a county. This is yet another way that we get to show the community that Doña County is investing in this community. And we don't always look for the easy wins. This is not an easy win. You're dealing with people's heads and hearts and lives. And so we thank you for the committed work you
support and for the time.
Definitely. And if you're somebody that's watching this or knows somebody that needs some help, you can give us a call anytime. Our number is 575-449-8159. And we got people that'll answer that phone 24/7.
Malachi.
He will answer the phone, he'll open the door for you. He's gonna make you a cup of coffee and do it all. That's peer support for us. Well, thank you all. We should be celebrating. There's reason to celebrate. Definitely. 1 year down and many more to go.
Go team.
Being the staple here in Doña County. So thank you all for those of you who have already been supportive. And for those of you who are introduced to the Crisis Triage Center, or we lovingly call it the CTC, for the very first time, I know this won't be your last time. We will continue to remind you that we are here for you. And so if there are no questions, I will say goodbye, Doña County.
Goodbye.
Bye.
Thank you.